So good afternoon. Today is June 8th, 2023. Welcome to the next episode of the STAT Regimen of Season 8, a series that provides recent updates on all things public health current to Rhode Island. My name is Ashley Chiarello, and I'm a final year pharmacy student from the University of Rhode Island.
And I'm Jeff Rapberg. I'm a clinical professor at the College of Pharmacy and an academic collaborations officer at the Rhode Island Department of Health. The opinions expressed in this podcast don't represent the opinions of the United States government, the Rhode Island Department of Health, or the University of Rhode Island.
Today, Dr. Rapberg and I will be discussing the current backorder and shortage of many branded generic, long, and especially short-acting ADHD treatment medications, amphetamine salts by the brand name Adderall and methylphenidate by the brand name Ritalin. In October 2022, the FDA listed generic short-acting Adderall as in shortage, perhaps due to an acute increase in demand during the coronavirus pandemic, exacerbating ever-increasing demand that began years prior to the pandemic due to greater diagnoses. Since then, despite promises to ramp up production and distribution, many patients and parents have been unable to obtain this medication and have made the switch to methylphenidate. Now, due to so many patients switching, Ritalin is also on backorder. Besides ongoing production issues with the supply, which are estimated to be resolved this month in June, another reason for increased demand was the emergency order from the Drug Enforcement Administration, allowing Adderall, Ritalin, and other controlled substances to be prescribed using telehealth without an in-person visit. Can you explain more?
Yeah, thanks, Ash. So prior to the pandemic, there was a law passed, the Ryan-Haight Act in 2008, that was meant to prevent people from having online delivery of controlled substances. But during the pandemic, since clinics and offices were closed, the DEA and other agencies involved in the regulation of medications said people aren't getting their meds. Let's allow temporarily to be started and sustained on controlled substances via telehealth because of those shutdowns. So two things really happened here. It was easier for people to get a prescription, whether your office was closed or not. So many people who weren't able to access traditional providers to get started on ADHD medications were given access, including people whose ADHD symptoms probably became evident during the lockdowns. But this also meant that many people who sought ADHD medications for other reasons, not for ADHD, or who didn't have a diagnosis, or maybe weren't screened properly, truly did not have ADHD, they also had these medications. In fact, a Rhode Island Department of Health analysis of the number of stimulant prescriptions dispensed from 2017 to 2021, so including portions of the pandemic, saw an increase in these prescriptions by 20%, with the generic and brand Adderall making up 3 of every 5 of these prescriptions.
That being said, what advice do you have for patients who are still having difficulties getting their ADHD medications?
Yeah, so this is the trade-off that's so difficult, is that we're trying to control these medications so they're not misused or used for the wrong thing, which is what we do as pharmacists and public health professionals, why we have laws to control these medications. But it becomes very difficult, whether it's ADHD medications or pain medications or medications for opioid use disorder, is that once you get started on them, you have to continue getting them. So if right now we're sort of in a lull in terms of the telehealth, so there's lots of options that you can do if you call your pharmacy and they just don't have it because of these manufacturing and demand related issues. So patients can contact their pharmacies to see if other locations of that pharmacy have the medication in stock. The second version is you can consider a generic version if you're on the brand, or if you're on generic, you can consider the brand and try to convince your insurance company to cover it or find out what's actually in stock at the pharmacy. It's important to note that the generic version of Adderall is pharmaceutically equivalent, meaning it has the same effect on the body and patients expect the same level of relief or treatment of their symptoms. A third option is there may be an alternative medication you can use in the meantime or that you stay on. You can ask your prescriber if there's other stimulants that may be available. So right now we're in that shortage that Ash talked about where Adderall products are in shortage. So then people switch to Ritalin and now those are in shortage. So it's really kind of talking to your pharmacy and your prescriber about what works best for you. But Vinase may be appropriate, or longer acting medications if you're on short acting, or vice versa. So you could get authorization again to use those brand forms of these different meds or of the med you're on, or to use an available larger or smaller dose. So the Schedule 2, you can't just make up different medications. You have to have the exact strength regimen. So you'd have to get a new prescription for a larger dose to cut in half, or, for example, or a smaller dose that then you would double the quantity to make up your usual regimen. There's also another option, which is switching to non-stimulant medications like atomoxetine, which is brand name Strattera, clonidine, or guanfacine, which is brand name Intuitive. They may be appropriate. And really, overall, this is an opportunity to evaluate whether the ADHD symptoms really are causing problems and do need relief from these medications. Of course, regardless of medication changes or other adjustments, providers should continue to work with patients and their caregivers and their families on behavioral strategies in addition to medication or without medication to manage their particular ADHD symptoms.
As a healthcare professional, pharmacist, or patient, it is important to know that other alternative options exist during a back order to assure that patients are receiving the necessary treatment. Thanks for joining this week of the STAT Regimen on the back order of Adderall.